Welcome to part 4 of renal GU disorders. This section is going to address vesicoureteral reflux. We abbreviated VUR. So vesicoureteral reflux is more common in girls than in boys. It tends to occur in the Caucasian population, and we usually find it in infants and young children. In fact, it's one of the leading causes of urinary tract infections in young children. And for this reason, when a baby is admitted to the hospital with a urinary tract infection, some of the diagnostic testing is going to be looking for this disorder. In addition to looking for this disorder, of course, the child with the urinary tract infection has a urine culture submitted and is treated with antibiotics. So what is this? I like to explain it as the valves where the ureters implant into the bladder, which are supposed to be one way, act as though they are saloon doors. They can go either way. And so the increased pressure as the bladder fills causes these valves to open the opposite way, therefore refluxing urine back up into the ureter and eventually into the kidney. The reflux of the infected urine into the kidneys leads to pyelonephritis. It can lead to scarring of the kidney as well as renal damage. The diagnostic assessment includes having a voiding cystourethrogram, a VCUG. This is an x-ray where they're going to shoot dye into the bladder and watch the urine. Is it only coming out or is it going back up the ureters? It is the nurse's responsibility to insert a urinary catheter prior to this child going down to radiology. We can do a renal ultrasound. The blood test will include the BUN and creatinine to monitor for renal function. And as I said earlier, the first symptom may be a urinary tract infection. And a urinary tract infection in an infant will present as irritability, poor feeding, may or may not have fever, so don't expect those infants to have the fever like an older child would. Then the older child is going to have the frequency and the urgency, may have that incontinence, painful urination. The urine will have typical features of being cloudy from white blood cells and may or may not have hematuria. Within 24 to 48 hours, we'll have the preliminary and then the final urine culture that's going to be positive for some type of organism. The next several slides are going to show you how vesicoureteral reflux is graded on a system of 1 through 5. The higher the grade of reflux leads to the greater risks associated with hydronephrosis and pyelonephritis. And so our grades 1 and 2 are not treated as aggressively as our grades 4 and 5. So here is grade 1. Here is grade 2. And you can see that the reflux is much higher. Grade 3, we're starting to see that the ureters are more dilated, as well as the renal pelvis. And then grade 4 and 5, you can see that from the kidney down to the bladder, it almost looks like a trumpet, especially in grade 5. And this is a very good depiction of hydronephrosis. Look at that X-ray. And this is secondary to obstructed distal ureters. How do we manage this disorder? The grades 1 and 2, and sometimes the grade 3s, will resolve over time. But our goal is to prevent renal damage. Medically, we're going to treat the urinary tract infections. So this child will go on antibiotics. When admitted, we're going to start out with 2 antibiotics, one of which may be gentamicin. We're going to do repeat cultures for the test of cure. For those who are toilet trained, we want to teach pericare, which is related to wiping from back to front. We want to avoid going into bubble baths, and we want to encourage this child to empty their bladder on a regular basis. There are some children who will require surgical intervention, and these would be your grades 4 and 5, or if the antibiotic treatment is not successful. The traditional surgery is ureteral reimplantation. They can also go through a cystoscopy, and they inject a gel-like agent into the base of the ureter. And this causes a buildup of a bulk, and it's almost like a sludge that doesn't move, and it prevents reflux. Refer to your textbook for further information on vesicoureteral reflux. Move on to the next part of renal and GU disorders.